My name is Dr. Leslie Sultan. I am presently in my office in Fort Lauderdale, Florida. That's South Florida, for those of you outside of the U.S. I am a board-certified oral and maxillofacial surgeon. Oral and maxillofacial surgery is that specialty of dentistry that deals with the diagnosis and treatment of diseases, defects, and conditions of the face, mouth, and jaws. I have been in practice for 34 years in South Florida, originally from Brooklyn, New York. I did my oral and maxillofacial surgery training in New York City at the Mount Sinai Medical Center. And have been in Fort Lauderdale, Florida for the past 34 years. My practice has dealt specifically with the reconstruction of the face and mouth and jaw structures, in particular for the past 10 years, dealing with deficiencies or atrophy of the upper and lower jaw, the maxilla and mandible. I deal with surgery and reconstruction of the temporomandibular joint, repositioning of the facial bones, known as orthognathic surgery. In dealing with the reconstruction of the upper and lower jaws, we deal with dental implant using specifically zygomatic implants for the upper jaw. We have a very small boutique type practice, very specific, focused on the utmost in patient care. We have a small staff. We spend a lot of time with our patients, especially during the initial diagnosis and treatment planning aspect of a patient's procedures. We specialize in the use of computer treatment planning and patient-specific design for each specific patient case. We are also unique in that we are able to do our surgeries not only in the office, but as well in the hospital setting, so we can treat just about any patient depending upon what their medical condition is. We have a concierge service where for patients that are coming in from out of town, we try to specifically design their care from beginning to end. And being a patient myself, I know it's very, very important to establish a good rapport with patients. My staff is bilingual in that we speak both Spanish and English, and we really try to make our patients feel comfortable from beginning to end. For whatever we can't offer, we try to get involved other subspecialties of medicine and dentistry to try and streamline the care of our patients. Mentioning again that one of the areas that my practice focuses on is the rehabilitation of patients not only that are missing their teeth, but also have deficiencies in bony and soft tissue structures of the upper and lower jaw. Whether it be a patient that's lost their teeth due to severe periodontal disease, it can be due to trauma, it can be due to pathology, neoplasms, or cancer, or tumors of the head and neck. These are patients that have thought that they were limited to just wearing dentures. These are patients that have had so much loss in bone structure that they can't wear dentures, that dentures are falling out in their mouth. And these are patients that are really ideal candidates for dental implant reconstruction. For those patients specifically in the upper jaw or maxilla that are missing so much bone and soft tissue, whether it be primarily due to bone loss or they've had failed previous implant reconstructions, they come to our practice for help. We have a motto saying that no patient can go with if they're missing too much bone, there's no problem because there's always help available. And these are the patients that we really enjoy treating, especially when we can provide them what's called teeth in a day or immediate smile or all on X type treatment. So zygomatic implants are a specially designed type of a dental implant. They were originally designed for treatment of patients with cancer defects of the upper jaw. Zygomatic implants are unique in that they are much longer than the standard dental implant. They were designed to be secured in the zygoma, or the cheekbone of the face, which embryologically is the strongest bone in the facial structure. They are meant to replace and support a specially designed bridge, and they can be placed and loaded almost immediately. And they are unique in that they can obviate the need for extensive bone grafting, for severely deficient bone in the upper jaw. A few things about choosing the right practice, about choosing the right surgeon to perform a zygomatic implant surgery. Training and experience. You want to choose a surgeon, whether it be me or anybody else, that number one is board certified in their specialty. Number two, he has the experience in dealing with many different types of implant situations, not only one in particular, and somebody who's seen the good, the bad, and the ugly. You want somebody who has treated not only the simple cases, but also the complex cases. Whenever treating a surgeon, you want somebody who not only has the surgical experience, but is a person, somebody that can deal with you, that can be dealing with the surgical condition, but also everything surrounding the surgery. You want somebody who's going to be approachable, who can deal with any complications that can arise. For people that are coming in from out of town, South Florida is a great tourist destination, and sometimes we can make your experience quite enjoyable and not just dealing, with the difficulties of the surgery itself. And, to throw in one more thing, we were one of the first ZAGA centers in the United States. The nice thing about the ZAGA centers is that there is camaraderie across the world with doctors with not as much experience or a tremendous amount of experience in the ZAGA concept. In training with the traditional intersinus approach for placing zygomatic implants versus the ZAGA approach, we really increased our surgical experience as well as our long-term success rate using the ZAGA concept, and that's also very important in choosing a surgeon for your treatment.